Hi everyone. So, now we've established that there are competing interests when it comes to the use of smartphones and other mobile devices in the workplace. On one hand, healthcare workers, especially nurses, identify them as powerful tools that improve productivity, enhance communication, augment knowledge, and support patient education. On the other hand, they are potential privacy and security risks that have the potential to cost employers hundreds of thousands of dollars per year. Also, nurses have an ethical obligation to protect their patients' right to privacy, and failing that obligation has the potential to jeopardize their professional license. So, is it possible to reconcile these competing interests? I believe that it is. Several hospitals now use cell phones that are unit based and shared between shifts. Each nurse is given one of these phones at the start of their shift, and it is passed to the nurse following them for the next shift. These phones, sometimes called pickle phones, have several advantages over personal cell phones. First, they provide a method of contacting a specific nurse via an individual extension that can be found in a patient's chart. This allows members of the healthcare team outside the unit to contact the appropriate nurse directly for information, questions, and new orders. Nurses can also use a built-in directory to contact attending physicians, consulting services, case managers, etc. Apps that use encrypted messaging, such as WhatsApp, can be repurposed to provide a secure text-based instant messaging service to replace normal text messaging. They are connected to the internet via the hospital's private Wi-Fi network, meaning they are protected by the same firewall as the standard computers in the unit. The hospital also has control over which apps can be installed on the device, and when coupled with antivirus software, greatly reduce the risk of malware exposure. Finally, as smartphones, they provide the same access to internet knowledge resources as personal phones, but without many of the accompanying risks. Hospitals would have the opportunity to curate approved resources as well, such as a specific drug or pathophysiology database or patient education materials. There are barriers to this solution that should be discussed. First, it does require a financial commitment to purchase enough devices to meet the needs of the facility. This barrier may be more significant for smaller facilities, such as private practices that have smaller operating budgets. However, I believe that a cost-benefit analysis would show that the initial investment in devices outweighs the potential financial risk imposed by HIPAA violations. Second, it would require a strict enforcement of existing personal phone use policies to shift the culture away from personal phone use to that of the hospital devices. The most efficient way to achieve this would be by ensuring that the device user interface is just as familiar and easy to use as the most common personal smartphone interfaces are, while also providing easier intra-facility communication and access to information and education resources.